Hi, this is Liberato Martinez. Thank you so much for joining me today. I am here to help you understand Medicare and help you with your Medicare journey because I know you have a lot of questions. I'm here to simplify things and make things easy for you. First of all, if you're watching this video, you're probably turning 65 very soon, so I want to wish you a happy early birthday. So now that you're turning 65, I have great news for you. You are now eligible for your Medicare benefits coming up on your 65th birthday month. So we're going to talk about what you need to know, and at the end of the video, we're going to talk about how to avoid getting those Medicare penalties. We want to make sure you don't get them and understand how to avoid them. But before we get into that, I want to let you know that this is your right as an American to have Medicare. It is every American's right to have Medicare, and this right cannot be taken away from you. As long as you worked in this country for at least 10 years and paid your taxes and you're a U.S. citizen or permanent resident, you are eligible for Medicare. This is your American right, and I want you to know that. So first, you need to understand a little bit about how Medicare works overall. The first thing you need to do, about 90 days before your birthday, 3 months before your birthday, you need to apply for Original Medicare. That's Medicare Part A, which costs you $0, and that covers your hospital. And you need to apply for Medicare Part B, B like boy, that is your medical, your doctor's visits, ambulance ride, emergency room, labs, x-rays, MRIs, that is your medical. Now, in 2024, it costs you $174.70 to be on Medicare. Mostly, there are income limits, and it is estimated for 2025, I want to emphasize estimated, this will be final in about another month, about $185 a month starting in 2025. Now you do need to know that Original Medicare Part A on its own covers you at 80% for anything that is non-preventative. So if you incur a major bill, you're responsible for 20% of that bill. So that's a big watch out, and you need to know about that. But we have solutions for that, which we're going to talk about. Then there's also Medicare Part C, C like Charlie, usually costs $0 depending on your area, also known as Medicare Advantage. This is optional. And then there's Medicare Part D, D for drug. This is your prescription drug coverage. And yes, you are required to have a prescription drug plan, and otherwise you are going to incur yet another penalty. So let's talk about your options now, okay? Now that we talked a little bit about Original Medicare, if you want to get into it a little bit deeper, go ahead and click right here, and we'll go ahead and review another video. You have your Medicare Part A and your Medicare Part B. Now you have two options. The first option is to go on to a Medicare supplement plan, also known as a Medigap plan. Remember that 80% that we talked about, that Original Medicare covers, Part B covers 80%, and you're responsible for that 20%? Well, imagine a $10,000 bill. Not unheard of. You're responsible for $2,000. $100,000 bill, not unheard of. You're responsible for $20,000. So the Medicare supplement plan will fill that gap. It'll cover that 20% minus your Part B deductible, and this year that's $240. So that would cover it. So here's how it works. You have to have your Medicare Part A. You have to have your Medicare Part B. Cost this year $174.70, estimated next year $185. And then the most common plan is Medicare Supplement Plan G, G like George. The national average for that is about $130. And then you are required to have your prescription drug plan. The rates there could be less than $1 all the way up to $100. Average is around $30 to $40. Now what are the benefits of having a Medicare supplement plan? Well, it's going to fill that gap, so you're not going to see a bill other than that Part B deductible, which is very small. You can see any doctor in the United States as long as they accept Medicare. So there's no network. That's a benefit. One of the downside is the cost. You're going to have to pay your Part B, about $174.70 or $180 next year possibly. You have to pay your Plan G, which is $130 on average, and your Part D, D like drug. So now you're looking at around $300 a month. So that's a downside. The other downside is it doesn't come with extras. It doesn't come with dental, vision, and hearing and other benefits. You would have to purchase that insurance separately, and we have options for that as well. So that's your first option. Your next option is your Medicare Advantage plan, Medicare Part C. C like Charlie, Medicare Advantage. Medicare Advantage will replace original Medicare. You still have to pay that Part B. There's no way around that. You have to pay that Part B, but Medicare Advantage will take over your health care, managing your health care. It does come with some extras like that dental, vision, and hearing in most areas. It also includes that Part D, that prescription drug plan. So you would satisfy that requirement at no additional cost. It does have a copay schedule and a coinsurance schedule. Those copays could be very, very low. Some could be a little bit higher, and that coinsurance could be as high as 20%. However, you would be protected with a maximum out-of-pocket. So if you reach that maximum out-of-pocket, and it varies by area, you would be done paying. That is your safety net. Now, you do need to stay in network. You have to see the doctors in the network for your specific plan. That's really important. Those are your two options. Option 1, Medicare Supplement, also known as Medigap, and Option 2, Medicare Advantage Part C. So, which option is good for you? Well, that depends on you and your unique situation. Everybody's different. I get asked all the time, which is the best plan out there? Just give me the best plan. It doesn't work that way because what's right for one person may not be right for the next person. So we need to take a look at what cost is in your budget. Who are your doctors and what's their network? What are your prescriptions? Because some plans cover prescriptions differently than another. Do you travel? Are you going to travel internationally? Are you going to travel domestically? Because you might need access to care outside of the area or even internationally. Does your plan have international coverage? How important are those extras to you? Dental, vision, and hearing, transportation. We need to know those things so that we can help find the right plan for you. So we need to help you find the right plan, so we need to do a review. Now, I talked earlier about talking about how to avoid penalties. So once you turn 65, are you required to enroll in a Medicare Part B and Medicare Part D? The answer is yes, you are required unless you have credible coverage like an employer plan. If you have credible coverage, then you're satisfying the requirement of having insurance from Medicare and you will not receive a penalty. Or perhaps your spouse, you're on your spouse's plan. That also satisfies it because you need to have credible coverage that would satisfy that. Now, later on, once you leave your work plan, you would need to go on original Medicare and Option 1 or Option 2, and you should start that process 90 days before you leave work because you only have a 63-day window to enroll in Medicare Part B like boy and get an additional plan, either Option 1 or Option 2. So I always recommend you start 3 months out before you're going to lose coverage. So here are the 4 reasons that you would incur a penalty. Number 1, you don't have any insurance. You have no health insurance at all. You're 65, you have no health insurance. You're going to get a penalty. You need to have insurance, whether it's Medicare or a work plan. Number 2, you stayed on your individual plan. This is a very common mistake. You say to yourself, I have insurance. I'm just going to keep the insurance I have. It works. I'm going to continue. The answer is no. You need to replace that individual plan with a Medicare plan or a work plan. Number 3, COBRA. You have COBRA coverage. You left your work plan and you went on to COBRA and you stay on COBRA and you're 65. That is not credible coverage. When you turn 65, you need to go on to a Medicare plan. You need to have Medicare Part B and Medicare Part D or you're going to get a penalty. Number 4, a retirement plan. You can't just stay on your work's retirement plan. You need to go on to Medicare. So if you have one of these 4, you must absolutely enroll in Medicare. It is required or you're going to get that penalty. And guess what? That penalty for Medicare Part B and Medicare Part D, D for drug, it will stay with you the rest of your life. It does not go away. The longer you are not satisfying the requirement every month, it will accumulate. So you need to know what is covered or what will get you a penalty and what won't. So you need to enroll unless you have credible coverage. So, one more time, which option is good for you depends on your unique situation, the cost, the doctor networks, prescriptions, do you travel, how important are the extras, and you need to start the process 90 days in advance. I'm here to help you. Let me know. We're here to review your plans. I have plans all over the country and licensed in most states. So please give me a call, and I'm here to help. And don't forget to like and subscribe. And I was hoping to get that one. Like and subscribe. And don't forget to like and subscribe.